Hello, friends, welcome back to my channel. So, today, as the topic suggests, we'll be discussing the actor OSCEs and the scenario will be recurrent Apthous ulcer. If you're new here, let me tell you about myself. My name is Shalu Joshi Bharadwaj and I am a GDC registered dentist. I'm practicing in the UK and I cleared my ORE part 1 and part 2 at the very first attempt. So I'm here to help you all who are sitting for your exam now. I hope you'll find this video helpful. Let's get started. So the scenario which we will be given to you or is that there will be a young patient who's complaining of having ulcer and the patient is regular attendee or they will be mentioning that patient is having good oral hygiene and you may be asked to take the history to do the clinical investigations or to give the possible treatment plan to this patient. Be very careful of what is being asked here. You might be asked to do first two things or second or third thing or all of them because you will be marked accordingly. You omit one of the things or you are, for example, if you are not asked to take the history and you are taking the history, you won't be marked for it. Clock is ticking. So just be careful what is being asked of you and how you are going ahead. Okay? How are we going to start? First is we'll start with the introduction. We'll introduce ourselves. So what hello Miss XYZ. My name is this and I am a dentist today. How can I help you? Ask for the chief complaint. So chief complaint is you can ask like how can I help you today or what brought you here? What can I do for you today? So these are the ways you can begin talking. You can build up your conversation. If you think that that may eat up your time and your ask is really long, although this one is not, but if it's really long, then you can say that my notes are showing that you are having this problem. Is that right? And then patient will say yes and then you can proceed. Okay, so these are the ways to start the conversation and to tell the patient that we are going to talk about this thing. Okay, next is show empathy. So how do you show empathy? You don't have to be sympathetic, you have to show empathy. You will say once the patient says okay, I'm having this ulcer and it's really painful, to show empathy you will say sorry to hear about that, but don't worry, we'll do something about this today. But before going ahead, I'll have to ask you a few questions. And this is how you will take your conversation to towards what you really want to know. You will get the information from the patient. So you will ask about the characteristics of the ulcer. How will you ask? What will you ask? You will ask about where exactly it is to know the site. How many of them are there to know the number? What size is it to know the size? When did you notice it first? Is it for the first time you got the ulcer or have you had it before? How frequently do you get it? How long does it last for? Does it heal with scarring or does it heal without scarring if you had it before? Do you have any ulcers elsewhere in the body? So this this number of questions about the characteristics of ulcer is going to give you an idea what actually it is going to be. What type of ulcer is the patient talking about? Here we know that we are talking about recurrent aphthous ulcers, so it's really easy. But in actual practice or in the exam, you will be given this information by the patient, and on the basis of which you will have to know that okay, it's recurrent aphthous. Okay, now we know that it's recurrent aphthous. Patient has given us all the typical symptoms of recurrent aphthous for all this. Then we will go forward with the associations. How will we proceed? So once we have asked all the questions about the characteristics of ulcers, we will tell the patient, thank you so much for this information. I have few more questions to ask. I hope you won't mind that. Thank you. And again, thank the patient. Okay, when patient says yes. And then you have to ask about the fast past thing. What is fast past? Fast past is family, anemia, stress, trauma, pregnancy, periods or oral contraceptives for females, allergies, smoking, tummy trouble. And apart from this, you have to ask about the diet of the patient. Okay. So in smoking, we will have to ask smoking cessation. From here, you are going to build up your management. So this is how we proceed. From all this information, now you have reached to your provisional diagnosis. Okay. And you will tell the patient that most likely It is recurrent aphthous ulcers. What next is you have to educate the patient. Now it's your turn to talk to the patient. Okay, patient is going to listen to you. You have to talk to the patient. Okay, most likely this is going to be recurrent aphthous ulcer, and now educate the patient. Like it's very common condition, very commonly seen in young people in their 20s and 30s. About 20% of the population is affected by this, and it affects females more than males. Okay, so after this I'm going you will be telling the management. So because there are it may be because of some lack of supplements in the food or some other allergies, so I will make a GP referral. He might get your blood test done and advise you with the supplements if you need any. Okay, today I'll be giving you the topical gel which you will apply over the ulcer and that will numb your area. Oral hygiene is very important. Because of pain you might not be able to brush your teeth properly, so I'll give you chlorhexidine mouthwash which I'll ask you to rinse the mouth at least twice daily. Okay, and discontinue once your ulcer is gone or you're able to brush your teeth properly. So once all this is done, offer the review to the patient. So I would like to see you in say 7 days after a week, and let's see how the things are going. And I would like to review the ulcer condition. Okay, is that okay with you? And then check patient's understanding and any queries. Always, always, always check the patient understanding. I hope everything is clear to you. Anything that you don't get, I can repeat. Any questions you are having? Thank you. So this is how you do actor OSCEs. Okay. I hope you like this video. If you want me to make more videos regarding OSCEs, actor OSCEs, or any other topic, please leave a comment in the comment section. Thank you so much.